is, and we don't know when it is. And if you look at the number of incoming cases, it's been remarkably flat for the past several days. So that's the best indicator of how containment is working and how the close-down policies are working. And over the past few days, we basically flattened at 1,300 new cases a day, which is not great. We'd like to see those new cases reducing even more, and we'd like to see them reducing faster. You then have other long-term questions. Is there a second wave of the virus? We talk about the 1918 pandemic. It came in 3 waves. Is there a second wave? Does the virus mutate and come back? The federal officials are starting to talk about the fall and potential issues in the fall. They're worried about the virus waning somewhat during the summer. Remember there was talk, will it go away when the weather gets warm? No one's really saying it will go away when the weather gets warm in the summer, but there's still a theory that the virus could slow during the summer, but then come back in the fall. If it comes back in the fall, then it comes back with a normal flu season. That's then problematic because you are then, quote unquote, testing for the flu and you're testing for COVID on top of all the other tests you do. That could be a possible overwhelming of the testing system. If people could have the flu or could have COVID in the fall and they don't know which it is, they could get nervous and start going into the healthcare system, which could then bring back a capacity issue in the healthcare system. So that's something we have to worry about and watch. Nursing homes, they are our top priority. They have been from day one. Remember how the nursing home system works. They are private facilities. They get paid to provide a service. They get regulated by the state government. There are certain rules and regulations that they must follow, and we put in additional rules and regulations on nursing homes in the midst of this crisis. Staff must have appropriate PPE. They must have their temperatures checked before they come into the facility. There are no visitors who are coming into the facility, which is a tremendous hardship, but it's necessary to protect public health. If they have a COVID positive person in the facility, that person has to be in quarantine. They have to have separate staff for the COVID residents versus the non-COVID residents. If they can't care for the person in the facility, they have to transfer the person to another facility. The nursing home is responsible for providing appropriate care. If they cannot provide that care, then they have to transfer the person to another facility. They have to notify residents and family members within 24 hours if any resident tests positive for COVID, or if any resident suffers a COVID-related death. That is a regulation that they have to follow. And they have to readmit COVID-positive residents, but only if they have the ability to provide the adequate level of care under Department of Health and CDC guidelines. If they do not have the ability to provide the appropriate level of care, then they have to transfer that patient. Or they call the Department of Health, and the Department of Health will transfer that patient, right? But that is how the relationship works. The state has very strict guidelines on privately run facilities. They get paid to take care of a resident. That resident, that patient must have a state-directed level of care. If they cannot provide that, they can't have the resident in their facility, period. Those are the rules. We're going to undertake an investigation of nursing homes now to make sure they're following the rules. It's going to be a joint Department of Health and Attorney General investigation. But those are the rules. They get paid to take care of a resident, and they have to do it in accordance with state rules. And if they don't, we will take appropriate action. And the State Department of Health and the Attorney General are going to be commencing an investigation to make sure all those policies are in place and being followed. If they're not being followed, they can be subjected to a fine or they can lose their license. It's that simple. Testing. Testing is going to be a major operation that happens from now until the situation is over. It's new, it's technical, it's complex, it's a political football, but testing does a number of things for us. Number one, it reduces the spread of the virus by finding people who are positive, tracing their contacts, and isolating them. That's a function of testing. Testing also, what they call antibody testing, you test people to find out if they have the antibodies. Why? Because if they have the antibodies, they can donate blood for convalescent plasma, which is one of the therapeutic treatments. So you want to find people who had it so you can identify them to donate for convalescent plasma. The testing also can tell you the infection rate in the population, where it's higher, where it's lower, to inform you on a reopening strategy. And then when you start reopening, you can watch that infection rate to see if it's going up, and if it's going up, slow down on the reopening strategy. Okay, so there are different forms of testing for different purposes. All of them are important. It was vital for any state, I believe, to first get a baseline study of where you are on the infection rate. All we know to date is the hospitalization rate. How many people are coming into hospitals? That is all we have been tracking. That's all we know. And then from that, you've had all sorts of anecdotal extrapolations on the hospitalization rate, saying, I think the infection rate is this, I think the infection rate is that. I said, I want to have the infection rate. So we have undertaken the largest, most comprehensive study of New York State to find out what is the infection rate. And that we started a few days ago. Sample size so far of 3,000 people statewide. Let's find out what the infection rate is. We have preliminary data on phase 1, and this is going to be ongoing. We did about the 3,000 tests. We're going to continue this testing on a rolling basis. We'll have a larger and larger sample, but I want to see snapshots of what is happening with that rate. Is it going up? Is it flat? Is it going down? And it can really give us data to make decisions. We did 3,000 surveys in about 19 counties, 40 localities across the state. The surveys were collected at grocery stores, box stores, et cetera. And that's important. It means you're testing people who, by definition, are out of the home and not at work, okay? What does that mean? I don't know, but that has to be a factor that's taken into consideration. These are people